Hello, everyone. I am Salim Virani, and I serve as Vice Provost for Research and Professor of Medicine at the Aga Khan University in Pakistan.
And I'm Kristin Newby. I'm a professor of medicine in the Division of Cardiology and a faculty member at the Duke Clinical Research Institute at Duke University School of Medicine.
So, we are so excited today to be talking about the 2023 American Heart Association and American College of Cardiology guideline for the management of patients with chronic coronary artery disease. Now, one other aspect was keeping in mind social determinants of health. Now, these are extremely important determinants to consider in treatment because there's a lot of evidence that they impact cardiovascular outcomes. These are determinants that are related to healthcare access, economic stability or lack thereof, as well as what is the social context as far as a particular patient is concerned. So you will notice that there's a strong recommendation that these should be routinely assessed by clinicians as well as the care team in terms of what we should screen for when we are talking to our patients about our recommendations. These include assessment of mental health, mental well-being, psychosocial stressors. Health literacy is part of it. Sociocultural influences, for example, their language, religious affiliation. What is the financial strain that our patient may have, which will, of course, affect out-of-pocket expenses, transportation-related issues, things related to patients' insurance status, barriers or to adherence of a heart healthy lifestyle. For example, issues related to food security. What are things related to neighborhood or environmental exposures, right? Some of these neighborhood related factors are extremely important when we are recommending physical activity. Then what are the social support systems that are available to our patients? Now, one other point I would make here is for those clinicians who are watching this podcast, I would refer them to figure 6 of our guideline that actually very nicely lays out a lot of these social determinants that we talked about, but also talks about what are the strategies that we as clinicians can employ to address those social determinants of health.
So, just as one example, we know that the neighborhood environment is important in a number of ways to cardiovascular disease. And one of those is, for example, environmental exposure to air pollution. It's very difficult to counsel a patient regarding environmental exposures because it may not be within their means or feasible for them to change their environment. But we can talk with them about how they can minimize their exposures and include that as part of their treatment plan. And if we don't do this screening, we can't help individuals find the appropriate care teams or community-based resources that are going to be important to them to help minimize their risks from chronic coronary disease.